Thank you all so much. That was brilliant. So I have a few questions and then we'll go out to the audience. So there are some targeted questions as well. So there's a long history and a strong focus on supporting women and children experiencing family violence, which has given us a strong set of frameworks, policies, measures and funding focus that we have today, particularly after the Royal Commission into Family Violence. The Me Too movement and the tragic murders of women on Melbourne streets and parks in recent years has provoked a more public engagement in the prevention of violence against women. So, starting with you, Anne, so what do we now need to do to support the development of resourcing for PVAW outside of the prevention of family violence?
That is an interesting question. I think Respect Victoria's remit is to work in both family violence and to continue the good work that we've been doing with prevention of violence against women. I also think that point about seeing these two things as in a binary way is damaging. We need to understand that there are intersections across both, that violence against women occurs within family violence contexts and family violence happens that may be driven by aspects beyond the gender-driven drivers that we are familiar with developing our programs and our prevention and our thinking around. So your question is about what funding, what support is necessary to do this work?
Yes, yeah, we've had a really strong focus on the prevention of family violence. So having it a stronger, more broader focus on prevention of violence against women and non-binary people, as we're seeing a lot of, more public abuse and murders of women, and in the Me Too movement, a lot of workplace sexual harassment.
There's got to be attention because the dollars are limited.
Yeah.
And trade-offs will be made and decisions will be made that won't necessarily please everybody because there is so much work to do. Respect Victoria will continue to advocate for more funding, more resourcing and more support to continue working in every area that is critical.
Yeah.
And that's not to say, though, that we won't, have to put on hold or reconsider campaign suggestions, campaign ideas, research projects, etc., because of the limitations around the funding dollar at the end of the day. I mean, that is the space that we're in. But we can work around that too by knowing what the sector is doing and where good work is happening. We can be doing advocacy and supporting those efforts as well. So I hope that in that way we would minimise any impact of trade-offs so that our efforts don't become a one or the other. We are focusing on as much as we possibly can be because the need is so critical.
Yeah, great. Okay. Does anyone else want to say anything?
Let me just say something.
Yeah.
I'm not sure if this totally speaks to your question, but I've been really heartened to hear about the extra campaigns, that campaign about violence towards health workers, which has just started as well. That I think that your point, Anne, about connecting with other work that's happening and acknowledging that we're not condoning any form of violence is also an important part. So a little bit is highlighting what within our Watch framework, the reinforcing factors in some way go towards meeting the needs of those people we are excluding in this space. So yeah, by any norms or stereotypes or structures or systems which are allowing any violence in our communities, whether it be health workers or on the sporting field or wherever it may be, that should be part of all of our work as well.
Yeah. Good. Okay.
Hi, I'm just going to break in here. Okay. For those that don't know me, I'm Jane Green. I work for Vixen Collective, which is Victoria's pair-only sex worker organisation. For those that do know me, you probably know that I'm used to stealing the mic. So just to answer that question, because it's a very relevant question for sex workers in Victoria, the Royal Commission in Victoria into Family Violence was a failure for sex worker community. It prioritised the voices of people that oppose the rights of sex workers, and the Royal Commission report did that. In terms of the space devoted to sex work, about 80% of that space prioritised the voice of an organisation called Project Respect, an organisation that is referred to by members of our community as Project Disrespect and is the most virulent anti-sex work organisation in the country. It has been significantly detrimental to our community, to the rights of members of our community, and has left sex workers in Victoria feeling that they are shut out of the family violence space, and as if it is a space that does not support the well-being or safety of members of our community. In terms of violence against women and non-binary people, and women including trans women, that's had a profound impact on us. We do not feel that we are supported by the Victorian Government in the family violence or anti-violence space, and the fact that the Victorian Government gave $340,000 to that organisation that calls for the criminalisation of sex work via the Swedish model, a model which is shown to increase violence against members of our community by over 40%, is shocking. And that needs to be recognised and it needs to be rectified, and our voices need to be included in these spaces.
Yeah, absolutely.
And people need to join our community in calling for things that would actually address violence against our community, and the key thing that would start that process, and it's not a magic solution to everything, but it's a start to addressing issues of violence against our community, is the full decriminalisation of our work.
Yep. Thank you so much, Jane. It really speaks to the gaps and the things that we still have to explore that are really pertinent and really, really important for us. And I'm so glad that you're both here today. So this question was for Alex, and it can also be for you, Jane. So can you tell us about any documented research that might assist us in developing a campaign about stopping violence against sex workers?
Lots. The most important research is... This microphone doesn't like me. The most important research is research that's done in consultation with our community. I can say that in terms of research that's been done in Australia, there's important research on migrant sex workers done by Scarlet Alliance, which is the national peak, in consultation with the Australian Institute of Criminology, that highlighted the barriers specifically for migrant workers in reporting to police, who have a very low incidence of reporting sexual assault, actually lower than sex workers generally have in reporting sexual assault, which is not good anyway for our community. I know that Vixen Collective, as the peer organisation here, has done independent research on barriers to reporting to police of both physical and sexual assault, and a range of other issues including extortion and threats and harassment. And there's organisations across Australia that are peer-based sex work organisations that have also done research of that type, and there's a variety of academic research. But the key thing to accessing that is to speak to peer sex worker organisations, because we're the experts in those matters. Yep. There's also very bad research out there that seeks to further stigmatise and marginalise our community. So again, the critical thing is to work with our peer-based organisations to get your hands on the right material.
Brilliant. Excellent. And that is RED and Vixen Collective.
That is Vixen. RED is the local health service that works with the sex industry, including a range of parties other than sex workers. Vixen is the peer-based org, and peer-based orgs are workers-only organisations that specifically exclude other parties in the sex industry. So we are workers only. We do not let other people like licensed sex industry business owners, managers, receptionists or other people. Workers only.
Great. We might circulate that around with the notes after the forum as well.
Something about research as a concept total though. Just want to add something because that also mentioned about research there is that for a lot of issues in family violence there could just be a complete lack of research, so that trying to start something or work on something and needing a body of research can be highly detrimental as well. I know with the trans project, the We Deserve project we're doing, there's not much research on transgender family violence or transgender relationships. It's very limited, and a lot of times organisations can put those sort of topics in a too hard to address because they don't have their body of research. We are working on something, but I just wanted to definitely point out that prioritising needing research before you do anything means that you can leave behind demographics who are lacking that research. And again, talking to the communities you want to work with and want to improve your working with is always step one, because even if there's not an official body of research, you will have things to say and and notes to give.
Yeah, okay. That really relates to my next question, which we often hear that there is that need to undertake research and data to undertake PVAW work for LGBTI women and non-binary people, also for older people in particular, but our role as PVAW workers is also to produce content. So Alan and Robin, I'm going to refer to some evidence that you have disclosed to my colleague Indira, which was done with the trans community in Canada and the US, and it's more apparently advanced in its... No?
Just to clarify, it wasn't from you. It was from a discussion I had yesterday with someone who was here from the trans community. So,
Okay. Okay, we'll leave that out. Let's just make it shorter. So what can we be doing as practitioners in the prevention of violence against women and addressing violence against non-binary people within our organisations, within our practice?
The first thing I want to point out there is there's also trans men that exist, and that's been ignored entirely, and that's a community that also suffers large rates of family violence as well. We can't just... it's good to include trans women into women's services and then non-binary people, but we also need to include our trans men as well who have, from what we, have heard, face a large levels of family violence as well.
Yeah.
Are you talking about specifically in terms of prevention? In terms of
primary prevention.
I think... Yeah, thinking about language in terms of binary. How are we contributing? I touched on that before. How are we contributing to language, and how is our program contribute to binary constructs around gender and sexuality? And do we allow for the diversity in the way that people define their gender, sexuality, the way they enact their sexualities in our programs? And I should say that's an easy thing to say and not necessarily an easy thing to do, because we're, facing the same complexity now in terms of the design of these resources, that we want to reach out to the diversity within the trans and gender diverse community as well, and that so trying to do things that meet the needs of everyone is not necessarily easy. But I think the first step is self-reflection and on whatever assumptions we might bring to this space, to women's services, to the prevention of violence or family violence, around who's the victim and you know, who we're trying to prevent violence for, and then to, you know, some kind of, is that if possible, some kind of audit around any tools or programs that you're using around breaking open that binary.
Yeah, okay, great.
Yeah, I think the other thing as well is just, again, I think I know the study that you referenced there, the Canadian one. I think there's also one from Scotland. I think that's mostly about it when it comes to the study. So,
Yeah.
like
Okay.
2 internationally.
Yeah.
Quite limited. And I think it's also understanding, like so I mentioned before, it's just untangling, is trying to understand, that whole thing we mentioned earlier about how family violence can be linked to other forms of violence people experience so inherently, like transphobia feeds family violence. Dealing with oppressive systems is a massive factor as well. Dealing with, you know, even just people's experiences of just, say, going to a doctor is something that was, when we're talking about asking people about family violence, going to a doctor was something that people brought up, and people wouldn't even think of, you know, medical discrimination or systemic discriminations from systems like that, or from police or something as connected to family violence, but they're all interconnected. Transphobia, homophobia, racism, ableism, it can be all interconnected, and we need to understand that as well.
Yeah. Yeah.
Increasing your own awareness about around trans and gender diverse people is something that's really important for us cisgendered people out there. We heard this really strongly in the focus groups around the othering that trans people experience in terms of the questions that they're asked, which I really relate with the ones that you put up there, which, being basically in terms of their personal lives, but also in public life, where people ask, or, you know, just invasive questions about their trans identity, which, have incredibly othering experience. And so the message was for cis people, whether you've got trans people in your lives or you're thinking about expanding your practice, to take on your own responsibility, to not go to the one trans person that you know and ask them a million questions about that.
Yeah, absolutely. Okay, so yesterday we heard about working together better and developing solidarity actions. So many prevention of family violence services and PVAW work has not been as inclusive of some communities that we're talking about today, and that's very clear. So some of the communities are quite upset, angry about exclusion, and rightly so. And the prevention sector needs to build these relationships in its work. So the question is, how do we build trust with those communities that are justifiably angry and frustrated? That's my question.
Time and effort.
Yeah.
Like years and years and years of work. It's not going to happen overnight. It's like we, on our project, have that limitation. It's going to take time and effort and energy and consistency and working with those communities.
Yeah.
I think the first thing that I would want organisations and people to recognise is where some of that frustration comes from. And it's a long history of systemic and institutionalised marginalisation, and that continues. And it's complex and it's diverse within the community. So when you're working with communities and they're frustrated and they're angry, it's important to recognise that within that context, there's a whole diversity of reasons as to where that anger is coming from. I think the other really important factor to remember when we're talking about prevention of violence against women and family violence is that it's a highly gendered space. It has a history and it continues to have a very strong heteronormative narrative that guides the work that is being done in this space. And that inherently puts a lot of people in the LGBTI community in a difficult position. And there's a history of exclusion and misunderstanding that goes with any gendered space. And it's work that's happening in our community to change that, but it's very slow and steady. And the other thing that I think needs to be remembered is that within our community, and when we're entering gendered spaces, there's going to be a certain amount of apprehension and fear in terms of whether people are going to be informed and inclusive. And as I think has already been mentioned, it's really important to ensure that your organisation and your staff, and not just your queer staff, but your staff, are going out of their way to get an education and build capacity within your own organisations to ensure that you can work in a more culturally competent and inclusive way.
Great, thanks. My last question is for Melanie before we put it out to the audience. So women live longer than men, so there's going to be more elderly women than men. How can we work better with older women from diverse communities to engage in our work and have them be involved in the design of our work?
Yeah, that's a really good question. It's something that, I mean, it speaks to the last question as well. One of the things we've been doing over years is that we do a lot of community awareness and kind of speaking to community members and focus groups and things like that, but also just spending time and going out and talking to communities and asking them what they want, what they need, what's the best way to approach answering those questions as well, because different communities will have different ideas about how they want to speak about things like family violence or how they see it as relating to them. So an example at the moment is that we've seen an increase over the last few years of people calling our helpline who have experienced abuse after coming to Australia on a contributory parent visa. And that's an area where these people don't have access to a whole lot of services and support. And they're also quite a difficult, I guess, population to reach out to because they're not integrated with all of those service systems. So that's one of the projects that we're taking. It's taking us a long time, but I think that's necessary to try and reach out to all the different groups that might be able to help us speak with these people and ask the people how it is that we can help. And we're trying to work towards some legal reforms on the exemptions that apply to those visas if someone experiences family violence. But I think it is that thing, it's time, it's effort, and which is really difficult. I mean, we're a client-led organisation. Most of our staff, we're only very small staff, but most of them do client work on the helpline or going out to see clients, and there's only about 3 staff members that do anything outside of that. And so it is kind of difficult to kind of get these conversations happening because we just don't have the funding because we're overworked as it is. Yeah.
Yes.
Can I just step in there? I don't know if anyone's reminded anyone, but Transgender Victoria's recently received funding to work with trans LGBTI elders as well around family violence, so they'll be doing some of that work.
Yeah, great. So maybe questions from the audience? Yep.
So far. Hi, I'm Vanessa Bourne. I've been working in the sector for quite a long time, most recently at Gender Equity Victoria, but no longer there. I wanted to follow up the comment for the panel, but probably also for all of us. It's not just directed at you, and it's sort of following up from what some of the colleagues in the room mentioned in the last session about the invisibility of asylum seeker women and looking at colonial structures, and they're just examples of a bunch of things. But we had really great discussions at yesterday's sessions about the political structures of society, and we often talk in this space, and I've heard it for years, about systems and structures, but we often talk about them as though they accidentally went wrong. And what we were talking about yesterday was really investigating the inherent nature of violence and inequality within the political structures. People named it different things: neoliberalism, capitalism, that idea of deriving profit, competing for that profit, and creating hierarchies based on that. and the sort of problems that we face in a sector where you're then trying to address inequalities and look at inequalities within a system that is inherently against that, and some of the issues with how we become co-opted with that, ideologically and physically, in how we do our work within the sector, whether it's funding, whether it's just ideological. And I'd love it if some of the people from the panel, and I don't want you to feel attacked because we're all part of this and we all make mistakes every day in trying to do our work well, but if we can comment about that contradiction of trying to create equality and inclusion within a system that inherently tries to divide and create inequality and exclude people, and how we deal with that, the errors that we make and our position within that, and how to push against it whilst being stuck within it at the same time.
It's so simple. I can answer that completely. Well, I completely agree, and I think we see it's one of the issues we come up a lot at Seniors Rights Victoria, because we're a legal service, and what that means is that often people come to us when they have a legal problem or a problem that can only be solved through the courts, or through police intervention and things like that. And so that therefore means we start to deal largely with financial abuse, with legal abuse and assets. And obviously the legal system is very patriarchal, and it's built on a whole lot of systemic oppression, and all of these issues apply, that we're trying to seek justice through a system that is not built on a justice that necessarily deals with any issues to do, I think, with families and relationships and things like that. So then the disputes become about property and finances and all of these things, and they're not speaking directly to the family or the relationships or the conflicts within the society in that sense. So yeah, I completely agree. I can see that in our work all the time, that we get co-opted into kind of trying to solve problems through the legal system and through other systems that are also partly causing these problems. Yeah.
Try and add something, I'm not sure. Part of Drummond Street, and I think I could probably speak for TGV's approach to address inequalities, part of it is through affirmative action employment, and it's not, it only speaks to it in a small way. But so having in terms of this project, having trans people, affirmatively engaged, training opportunities, but not only, Robin, like we've just employed 6 trans and gender diverse people to design and roll out the development of the initiative. So training, development, mentoring, providing opportunities for employment, yeah.
I think it's a big thing of looking around and seeing who's not there is a huge part of it. Looking around your service in staffing, in people accessing and approaching services, and seeing who's not going, because, like, say, if you've never had a trans person come, contact your service before, that's not that there's no trans people looking for it, it's the fact that your service is probably not welcoming. And that can be the same for any demographic of people who's not involved with services, or has contacted, or you see represented, they're not there, they're just, you can't see them, and that's on you, and that's, your organisations need to work on. And we have that, as every org, I think, has that issue to some extent.
I'm kind of thinking on the run here, but I guess my response to that was kind of personal, thinking about being a cog in the wheel, of these systems and stuff. And I actually was just talking to my housemate about coming to do this talk and the panel and stuff, because I was feeling like, man, I'm like a white, straight passing, cis passing, quite privileged person, and being given this platform to discuss this stuff, that I feel like there's other people that, really could have a lot to contribute. But like, I've been given it, and it's kind of like struggling with like feeling like a learner and feeling like also, super privileged to be speaking about this stuff. Her advice was just like to, that it's okay to be learning, and it's okay, if you are given the mic, to, use that to raise up the voices of more marginalised people and to, to speak to those issues. I guess that was just kind of my personal response to like working within this, colonial system of just like, I guess, trying to use your privilege. I'm trying to be across intersectionality. I work in an organisation that's like got a rainbow tick, but like, dead named me in my signature and wouldn't let me change it until my colleague kind of advocated really hard for me, who'd only been there for 2 weeks. She started after me, 6 months after me. I don't know, I guess I'm gonna start kind of getting into disjointed ideas, but just kind of thinking about the thin veneer of kind of friendliness, queer friendliness or whatever in organisations, and but just as individuals, I guess the thing that keeps me going, and I think that probably for a lot of people that do helping work, when you're in the machine, is you'd get burnt out if you weren't working one-on-one with those individuals or thinking about that, that positive effect that those little drops, and it's all like drops in the ocean. So we've all got to just take responsibility for being across the issues, and I don't know, one drop at a time, trying to slow the wheels of the machine.
Great. Yep.
I feel like I have a responsibility to answer this question because, I am sitting in the bowel of the government. But I would like to answer it really personally because this is a particular tension that I feel. Right, I had spent too many years in the Queensland government, swore I would never work for any government ever again. And I worked quite deliberately in Cape York because with my partner, we felt that is where you can have the greatest impact because you're working with some of the most marginalised communities in Australia and potentially the world. And so if you are going to rail against the system, go somewhere where you can have the greatest impact, where you can be the most effective, where you can get up in the morning and know that your energy is doing something, that is going to help to deconstruct and dismantle some of these systems that we've both inherited and are continuing to reproduce. Having said that, why am I here in Victoria with Respect Victoria now? Part of those systems that we are engaging with on a daily basis are actually global. Their forces come beyond us. And I recognise in this Victorian government, and particularly with our minister, some effort at bringing in the margins into positions where they can exercise more power and have more voice. And I think that's what's attracted me to Respect Victoria. It is a feminist organisation. We operate with a feminist ethic, and we are determined to work within that system to have the best effect that we can. You'll be the judge of whether we are radical enough to have a greater impact that you would like to see. But I just feel that there's enough really well-intentioned, feminist-driven individuals with great experience who want to make the most of this opportunity that we've got with this government, and it's not something we're seeing in other parts of Australia or in other parts of the world. So seize the day.
Yep. Great. I'd like to thank all of our panellists for an amazing discussion and their presentations. I encourage all of you to speak with them later. We have many of our panellists will be attending the workshops. Just before you go, I have hidden small gifts. So thank you so much. Thank you. Thank you.